Good afternoon, everybody. Today is October the 14th, and we are one day away from the annual enrollment period for millions and millions of seniors across this great nation. There's been recent news that AT&T are going to shift their healthcare plans for the retirees and no longer offer those rich benefit plans to hundreds of thousands of retirees of the AT&T Corporation. This is a really difficult period for many folks faced with this transition. And we were lucky enough, I was lucky enough this past week to be invited to the local Communication Workers of America Lodge here in Kansas City and speak to about 50 folks who were faced with this transition. And there was many questions and comments and concerns about the transition. So I decided that I would put up a quick video and duplicate the presentation that I had for the retirees that were present at the CWA meeting. And we started off basically by talking about how this transition is going to work. AT&T have contracted with AON Hewitt, which is a global provider of services for corporations, and they have a call center in Chicago that is responsible for helping you transition to Medicare. These are hourly paid employees, and they are currently being trained on everything Medicare. So I've heard plenty of comments that some of the initial meetings, telephone meetings that people have had, that there are many unanswered questions. So hopefully this guide will help you cut through the clutter and give you a good solid foundation of how to handle this transition for yourself and make it more comfortable for you. And of course, we're always here to help and answer questions for you. First thing I would say is go out to your local Social Security office or go online to Medicare.gov and make sure you have these two publications, folks. It's the Medicare New 2015 Guide and the Choosing a Medigap Policy. There's a new edition of 2015 available. Have those delivered to your home. Take a quick look through them, get an idea of how Medicare works and specifically how Medicare supplements work. Just as a brief overview, let's talk about Original Medicare. Most folks know that it covers approximately 80% of all the costs that you may incur at a hospital or a doctor's facility, any type of medical. So there's co-insurance and co-payments and out-of-pocket expenses with Original Medicare, but a supplemental plan will fill in those gaps. That's why they call them Medigap plans. You need to know that there are no networks with Medicare. You need to know that Medicare Part A is free for most folks. Actually, it's not free because you paid it in your taxes while you were working, but there are no premiums with Part A for most folks. Part B monthly premium for pretty much everybody is $104 unless you earn a whole lot of money. You'll pay a little bit higher. When it comes to Medicare, there are two routes that you may take in order to fill in the gaps of Original Medicare. On the left side, you can get a Part D prescription drug plan and a Medicare supplement or Medigap policy, or you can go to the right side and get a Medicare Advantage plan, also known as Part C. Because you've been used to having rich benefits year after year while you were working with AT&T and its affiliates, you will probably more than likely want to get a supplement just because it's more comprehensive and gives you better coverage. Now, what do we need to know about Medicare supplements? Well, the first thing and the only thing is that Medicare supplement plans are exactly the same for every company that sells them. A Plan F is a Plan F. A Plan A is a Plan A. Doesn't matter which company you choose, the benefits are exactly the same. The only difference is the premium that you pay. That is right. This is a competitive business and the marketplace is hot with many insurance companies selling these products. But the only difference is the premium that you pay. What plans do I like? Two, really. Plan F and Plan G. We really only sell three plans here at Prairie Health and Life. That's F, G, and N. And I don't even like to sell Plan N. But Plan F covers 100%. It is the most popular plan in the whole nation. 99.9% of seniors have Plan F. It's the most expensive, but it gives you 100% coverage. What's better than Plan F? In my opinion, Plan G. Plan G is exactly the same as Plan F, other than this little box, which is the annual Part B deductible, equivalent to $147. So you're going to pay a less premium for Plan G, you're going to get less rate increases year after year with Plan G, and the only difference is the $147. So just to take a quick look at the difference between a Plan F and Plan G, quite frankly, either one of these is going to work fine. I just happen to like Plan G. But Plan F covers 100% of the gaps in Medicare Part A and B. You'll never get a bill for your covered services, and it is guaranteed for life, renewable as long as you pay the premiums. The same goes for Plan G. Exactly the same, other than the $147 deductible. We talked a little bit about the AON exchange, and it's important to understand that you must purchase at least one Medicare product from the AON exchange in order to receive your health reimbursement account dollars. The initial payment for the health reimbursement account is $2,700 if you're single, and I believe $4,200 if you're married for your spouse. So you must purchase one plan, and it says in plenty of documentation from AT&T that you must enroll in medical and or prescription drug coverage to get your HRA dollars. So we have a three-step process that makes it pretty simple. Go through the AON exchange, purchase your drug plan. Generally about $30 or $40 will cover you for a drug plan on a monthly basis. Go out into the marketplace, shop with your local independent agent and get the best Medicare supplement rate, be it a Plan F or a Plan G, and use your HRA funds to pay for both premiums. Now we recommend that you purchase a Medicare supplement plan with an annual premium. That way you only have to submit documentation one time for your reimbursement. So you can also do it on a 6-month or a 3-month renewable bill, or you can do it monthly. We recommend annually, just a lot easier and less paperwork, quite frankly. So you're probably asking yourself, why do I need an insurance agent whenever I can do everything through the AON exchange? Well, we pulled a quote just a little while back, Kansas City metro area, zip code is 64152. At that point in time, there was only 3 plans available on the exchange for a Plan F. And if you look at, for example, a male age 70, you can see the lowest premium was from Sterling Insurance at $220.50. Well, we can go out into the marketplace and choose a different company and get a lower premium at $187.57. Folks, that's about a $400 per year savings, and I don't like giving an insurance company money when I don't have to, so I'd recommend shopping with a local agent and making sure you're getting the best rate for the plan that you choose. Working with an independent agent locally is going to serve you many times over as the years go by. He'll be there to review your policy, make sure your rate increases aren't getting out of control, and to shop for new plans if you need a new plan. He can help you with your Part D selection, and he's easy to communicate and easy to talk to and get a hold of. I can guarantee you that the people at AON will not be calling you in 12 months or 24 months and telling you that you got a rate increase. They just won't do it. So we are here to help you. My name is Paul, and you can contact us at 800-405-4802, or you can email at paul@medicarekansascity.com. Thanks again, folks. Have a great day, and we look forward to speaking with you soon.